We're back 7:39, Your Health this morning. And for months, we've been following the rise of drugs that have become very popular for weight loss.
So now a new study is revealing another potential benefit, suggesting Wegovy can reduce the risk of heart attacks and strokes in some adults by 20%.
Yeah, the study was published in the New England Journal of Medicine. We should note, though, it was funded by Novo Nordisk, which produces both Wegovy and Ozempic.
All right, let's turn to NBC News medical contributor Dr. Natalie Azar. Good morning. Okay,
Morning.
with all of those disclaimers aside, what did the study show?
This study demonstrated that if you are an individual who has a pre-existing history of heart disease, so you've had a heart attack or a stroke, if your BMI is 27 or higher and you're not diabetic, taking Wegovy weekly can cut your risk by 20% of heart attack, of death from any cardiovascular cause, as well as stroke. And that 20% was really driven primarily by a reduction in heart attack. It should be noted that, as you mentioned, Ozempic, which is a sister drug to Wegovy, is already approved to reduce cardiovascular risk, but people who are diabetic. So this is the first medication that is indicated solely for obesity that has shown to cut cardiovascular risk.
So is it cutting the risk because you are dropping the weight, so all your numbers are much better?
Don't know. So that's obviously one thing, because we know that obesity is a huge driver of cardiovascular disease, but there are another couple of explanations. For example, is it because you're actually cutting down your blood pressure? Your cholesterol is being lowered, your blood sugar is lowering, and also are you reducing inflammation? Those metabolic changes were actually detected before people started losing weight.
Oh.
So it's not, it clearly appears that it's not just the weight loss, but also there's these benefits, including reduction in waist circumference, which we know is a huge risk for heart disease.
Has anything changed when it comes to insurance? I know if you have diabetes, it's covered, but if you don't, a lot of people want to take the medicine, and it's so expensive.
So not yet, but the hope is that this, again, is going to change the perception that these medications are only purposeful for cosmetic reasons, but that they are actually indicated to treat the chronic disease of obesity and overweight. It's notable that in 2006, Medicare started covering bariatric surgery, not to treat obesity, but to treat the downstream consequences of obesity. And you could really try to use the same analogy here to get more insurance companies to get on board with covering it.
Did the study address whether once you get off those drugs, whether those health effects with regard to the heart go away?
They didn't, because they really couldn't, because they only followed people for a little bit of over 3 years. But we already know, of course, that when people stop the medicine who are taking it for their weight, regain roughly 2/3. And one could make the argument that if the medicine is doing these things metabolically, that once you stop it, those numbers would probably start shifting back to their baseline, their pre-treatment levels.
Very interesting.
Thanks, Dr. Azar.
Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.